All right, welcome everyone. My name is Lawrence Kinnaman. I am the host of the Equity Circle podcast. Today, we're going to be doing a video podcast interview with Shelly Slaughter from Thurston County Public Health and Human Services. So, welcome to the podcast.
Thank you so much, Lawrence. I'm so happy to be here today.
Well, thank you for being here. Why don't you just tell us a little bit about yourself, what you do, and tell us about yourself personally as well.
Sure. Okay. Well, I am, as you mentioned, Director of Thurston County Public Health and Social Services, where our mission's working together to achieve the highest level of health and well-being for everyone in our community, which is intentionally a definition of health equity because that's really important to us.
Yeah.
One of the things that I'm responsible for in my job is to control and prevent the spread of contagious diseases such as COVID-19. So I serve as the administrator of our local Board of Health, and I've been overseeing our county's COVID-19 pandemic response for over 600 days now. And in my—
Not that you're counting, right?
Right. It's been a long time.
I believe that.
Yes. And in my personal life, I am the mother of 4 children, and I try to spend as much time as I can with them. I'm originally here from Thurston County here, so really enjoy the outdoors when I'm not busy working.
Yeah, absolutely. Well, thank you for letting us get to know a little bit more about you. So, today is kind of you were mentioning we're going to be talking about the vaccine, but we're also going to be talking a little bit about equity as well. Obviously, it's the name of our podcast, and it's something that, as an organization, we're very serious about and are always trying to talk about. So, before we get into that, though, I would love to hear if you got vaccinated and why you chose to get vaccinated.
Yes, I am vaccinated, and I was really fortunate to get vaccinated last winter when I became eligible in the phases that we were at the time. And I got vaccinated with the Moderna vaccine, which was the first vaccine that was available to me. So I was really happy to get that. And why is it important for me to get vaccinated is because I have seen the devastating impacts of COVID-19 on members of our community. Vaccines are safe and effective and the best tool that we have to end this pandemic and save lives. It greatly reduces the chance of transmitting the virus to others, reduces the chance of hospitalization and death. So that was something that was really important to me. As I also mentioned in my intro, I'm a mom to 4 kids. One of my kids is 10 years old and he's not yet eligible for the vaccine yet. We hope that he will be soon.
Yeah.
We anticipate vaccines for 5 to 12-year-olds being approved in the next month or so. So looking forward to that. But I also have another child with a serious underlying health condition. So I wanted to make sure that my family was protected, and I wanted to make sure that I was doing my part to protect others in our community.
Yeah. So for you, not just from a public health standpoint and seeing the impacts that it's had on Thurston County members, but also just as a mom who really cares about her kids and wants to make sure that she's protecting her kids. And so it sounds like for you, those were some of the reasons why you chose to get vaccinated, correct?
Yes, absolutely.
So in hearing that, I'm curious, what sort of acceptance have you seen? Someone who works in public health, what sort of acceptance have you seen in the Thurston County community when it comes to the vaccine?
Well, we're really encouraged lately about increasing numbers of people getting vaccinated. In the beginning, it was a little bit of a slow uptake and not everyone had access to the vaccines in the beginning, but now we have vaccines widely available. And currently, about 56% of our total population in Thurston County, which is about 294,000 people, is fully vaccinated. And 61% of our population has had at least 1 dose. In those ages 12 and older who are eligible for the vaccine, we're now above 70%. So that's really great. And we're really encouraged by that. Our vaccine rates compared to other counties in the state of Washington are in the top 10. So we're really glad for that. Nevertheless, there's still many more people that still need to get the vaccine. And so we're hopeful that people will do so, and we'll continue to see those rates go up.
Yeah, absolutely. So I know you shared some of your reasons for why you got vaccinated. Can you share maybe some of the reasons as people have come in and they said, "Hey, I want to get vaccinated." Can you share some of the things that people have shared with you? Like, this is why I chose to get vaccinated. Here's some of the things that made me decide to get vaccinated. I'm curious if you could tell us a little bit more about that.
Yeah, sure. So, at one of our community based vaccine sites, which is located within Capitol Mall, and we operate that vaccine clinic 7 days a week, we have a board behind the vaccine area. And when people come in, they can fill out little cards or sticky notes to post as to why they got vaccinated. And it's really touching and inspiring to read. I mean,
Hmm.
some people just uh, they waited a long time to get vaccine, and they've been
Yeah.
through a lot of challenges or concerns for the health of their dear family members, or have lost family members, which is so sad to hear.
Hmm.
And it's many people that just care about our community. They care about uh, their families, and they want this pandemic to be over. People are really, really tired of it. They want to get back to
Yeah.
life as we knew it before.
Yeah.
Others, others have concerns, and we understand those concerns. And some of those things that we hear people um, say is, they're waiting. They're waiting to get vaccinated till more time goes by or more research is done. They're worried about how fast the vaccine came out, or um, they've heard on social media or things on the news or from friends and family um, that it might impact their fertility,
Hmm.
or
Yeah.
they're concerned that they might have a side effect and that will prevent them from going to work and they can't
Sure.
afford to miss work.
Sure.
So,
Sure.
so we definitely understand those concerns, and we know that these vaccines that we have are very safe and effective. They have been well researched, the most research tested vaccines ever in our history. Side effects are very rare, and we literally have seen these vaccines save lives.
Yeah.
Most of the people that we've seen recently that unfortunately are being hospitalized or dying are it's a younger demographic, and it tends to be those who are unvaccinated.
Yeah, that's something that I know in one of our conversations we had with a video interview we had with our choice board and people who are hospital executives have shared a lot about the concerns with those that are being hospitalized, a lot of them being unvaccinated. And I am curious to hear a little more. You've kind of shared a little bit, but can you just share a little more about maybe some reasons why you're hearing hesitancy? I know you kind of mentioned people are concerned about timeline or if it's going to affect fertility, but can you share a bit more about what you've heard?
Yeah. So really, those are probably the most common things that we hear. Um, sometimes we've heard some other things like people are, um, they are concerned about those long term side effects, or
Sure.
they think
Sure.
that maybe they already had COVID-19 and they think that they should have enough natural immunity that the vaccine won't be helpful to them. But research has shown that that's not the case. And even if you've already had COVID-19, that you're going to be more protected from serious illness, hospitalization, and death, and less likely to transmit it to others if you're also vaccinated.
Mm,
So there's sometimes some, other theories that people have heard that are not accurate, like that there's uh, something in the vaccine that's being injected into them, and they're being tracked, or people are magnetic, or things like that. And
sure.
so that's not accurate. But we know people hear those kind of things, and they have questions and concerns, and we want to make sure that they have the accurate information to make the best decision for the health of themselves and their families.
Sure.
And then the other thing, since we're talking about equity on this podcast, is we also understand that uh, trust in government and trust in public health is something that is earned. It's not
Yeah.
it's not something that is automatic. We have historical precedent for really doing harm to certain groups of people, and we understand why they might be worried or concerned about getting a COVID-19 vaccine. So
Yeah.
we want to work together with our community members, especially our BIPOC community members, to really share that accurate information so they can share it with others and so we can get our entire community safe and healthy and protected from this virus.
Yeah, and I appreciate that you brought that up, Shelley, because I know that's something that I wanted to ask you today, and I've previously have attended meetings that you've been in where you've shared some data about how COVID-19 has affected some of the um, underserved populations, and so I'm curious if you could just share a little more about what that has looked like for those populations and how it's affected them.
Yes. So um, in Thurston County, a little over 25% of our community members are identify as Black, Indigenous people of color in our community. And what we have seen with COVID-19 uh, confirmed cases is that there's an overrepresentation than what we would expect to see in our BIPOC community. So more people have had COVID-19 than uh, than really should be the case. So that's one thing that we've been really concerned about, that equity gap we see among people who have had COVID-19,
Mm,
and what we can do to share good information and help protect our community from poor health outcomes, hospitalization, and death. And we see this in other aspects of health as well.
sure.
But this is definitely something that has been a really big concern for us. At the same time that we've seen our BIPOC community overrepresented in the number of COVID cases in Thurston County, we've seen an underrepresentation of that same community in terms of who is getting vaccinated.
Yeah.
So, in order to really get to reduce the number of people getting COVID-19 in the BIPOC community, we need to be able to increase those getting vaccinated. And I'll give some examples. One really alarming disparity that we've seen is amongst our population that identifies as having Hispanic ethnicity.
Mm,
And uh, those who are Hispanic make up for about 9% of our total population in Thurston County, but we've only had 6% of that same population fully vaccinated.
mm,
So some people ask, well, 3% is how significant is that? And it is hugely significant because that's about 25,000 people in our community
yeah.
that are not protected from COVID-19.
Yeah.
So we want to do everything that we can to help support that community and reach out as much as possible and ensure that we have equitable access to vaccine, and that's a really important priority for us. Also, we've seen in our Asian Pacific Islander community, and two of my kids are Native Hawaiian, so this is especially important to me too.
Yeah. Yeah.
They have had about double the rate of COVID infection
Mm,
in relation to uh, what percentage of our population is Asian Pacific Islander, so Native Hawaiian. So that is a real concern. And at the same time, we've seen about that same kind of disparity in vaccines. So we really want to focus on making sure that we are reducing COVID-19 and increasing vaccines in our community and doing everything that we can to promote equity in vaccines, especially.
yeah, and it sounds like it. The you mentioned it in the beginning of the podcast, just talking about the mission of Thurston County Public Health and Human Services really is to to reach and help everyone. And so it's very clear, just seeing the data that you showed and or that you shared, excuse me, that you really are trying to make that a focus and walking that out. And so I am curious, what sort you've talked about, especially in the underserved communities, the importance of earning that trust. So can you talk a little bit about what that's looked like, to earn trust, with those communities, especially during this pandemic?
Yes, I think one of the really important things uh, has been to make sure that we have strong relationships and partnerships with trusted members of these communities. So, neighborhood leaders, uh, churches, you know, physicians in the community, healthcare
Sure.
providers, um, and nonprofit organizations. So it has been really important for us to develop partnerships and have early conversations and engage uh, with members of our community and find out what questions they have. Ask what are your needs in in the community. What can we do to help increase vaccine confidence in those you serve or in your neighborhoods, in your communities, in your churches, um, in your workplace. And so that's been one of the things that we've really tried to focus on throughout this pandemic. We also want to make sure that we have um, language access and materials and information that is available in a way that people need and want and is natural for them to receive that information. So we really
Sure.
tried to
Sure.
do a lot of outreach in that way. We were really fortunate to hire a diversity, equity, and inclusion coordinator just to focus on helping us to develop and evaluate our COVID-19 pro equity strategies.
Mm,
So, helping to make connections in the community and get our mobile vaccine units out to communities. We don't expect people to come to us. We know that we need to come to where people are at in the community, whether that's at their workplace because they're really busy in the day, that's in their neighborhood, that's in their local community center,
sure.
their
Sure.
local school, their church. So that's been really amazing, uh, really enriching work to be able to find and work closely with these partners in our community to do this. So that's been really really great, and
Mm,
we continue to try to do that just as much as we possibly can. So
absolutely.
if there's anyone that's listening that wants us to come to your community and bring our mobile vaccine unit, uh, every single vaccine we give one vaccine at a time. That matters. That makes a difference.
Yeah, absolutely.
You have to, like you said, with this trust, it takes a long time. As I've said in previous um, meetings and presentations I've been on, there's been hundreds and thousands of years of racism, and we're not going to fix that in one vaccine clinic.
Yeah,
We're going to be there again and again and again, and
absolutely.
support our entire community.
Absolutely. Well, Shelly, I really have appreciated, hearing about the work that you all are doing, and the ways that you're building trust and continuing to help people get the vaccine and increase access. As we come to a close today, is there any other final encouragements or things you would like to share, as we come to a close today?
I just want to say thank you so much to you, Lawrence. Thank you so much to Choice Regional Health and Cascade Pacific Action Alliance. And we've been really fortunate to be in a partnership with you as one of those organizations that is helping us to increase vaccine access, education, information, awareness in our community, and make sure that we are all working together to be focused on equity so we can have the best health and well-being for everyone and end this pandemic. We hope soon. Get as much protection for everyone in our community as possible. I would just say, for those looking for more information and they're looking for uh, accurate science-based information, to please visit our Thurston County Public Health and Social Services website. If you're looking for uh, where you can get vaccinated, if you are uh, looking for information about testing, general information about COVID-19 and how to keep uh, yourself and your family and your community safe and healthy, please visit our website or the Washington State Department of Health. And again, if we would love to come out and offer vaccine in more places. So please let us know if there is anything we can do. And for those that have still been kind of on the edge and not sure whether they should get the vaccine or not, uh, please get vaccinated as soon as the vaccine is available to you. That is the best way that we can ensure that our entire community is safe and healthy. So thank you so much.
Absolutely. And well, thank you. We'll make sure to put those links in the show notes as well so that people can have access to them. Thank you again, Shelley, for being on the podcast today. Thanks you to our listeners for listening to another episode of the Equity Circle podcast in video format today. We recommend that you subscribe and leave us a good review on our podcast. You can find us on Apple Podcasts, Spotify, and much more. And lastly, remember that equity equals progress.